Even as mask mandates are being dropped, new data from the CDC suggests COVID cases could ramp up again.
In fact, they're already spiking again in some parts of Europe and China.
And there's growing debate whether people will need a fourth vaccine shot. UW Health's Chief Quality Officer, Dr. Jeff Pothof, joins us once again.
Always lots to talk to you about.
Never a dull moment.
So there's a sewage water study that's going on right now, and there seems to be an increase in COVID in Madison, Milwaukee, Green Bay.
Yeah, so if you have a snack, you put it down right now. But about 80% of people who have COVID will shed that virus in their stool. And then we can pick that up at wastewater treatment plants. And what we are seeing in some areas of the country is this percent of virus is increasing. That would suggest more cases, which isn't so surprising. We've got rid of masks. People are gathering together. So to see that isn't so surprising. We just want to make sure that that doesn't translate into more hospitalizations. We want these to be people who are asymptomatic, mildly symptomatic, but not completely surprising.
So that's what you're watching, the hospitalizations.
Hospitalizations are really important because that's where we get back into reversing what we've done, mask mandates and things like that, is if the healthcare resources start to get overwhelmed. So far, we're not seeing that here in the United States.
Well, the virus is down, but definitely not out. And this wastewater detection, it's been a very useful tool, as you said, in detecting COVID trends. But the numbers over the last couple of weeks, as Mark was just alluding to, have been a little concerning, especially on the East Coast, the Northeast, and the Midwest. Between February 24th and March 10th, the CDC said 37% of wastewater sites saw the presence of COVID increase 100%.
Yeah. Yeah, now it's hard to know what that means per se. Right. That doesn't mean there's like a 100% increase in cases, but it does mean that when we take off our masks and we start to gather, more people end up getting COVID, and then we can detect that in the wastewater. So, it's certainly something to be mindful of. We should pay attention to this, and then, watch those other metrics. Are we starting to see more positive tests? Are we starting to see more hospitalizations? It doesn't mean that we'll see that, but it's, worth paying attention.
So it's not that concerning?
I would say, it's good to be vigilant, but at the same time, I'm not running to grab my mask just yet.
What is going on in Europe?
Yeah, so what we're seeing in Europe is an increase in cases. This is predominantly BA2, also known as like stealth Omicron, or just that subvariant of Omicron. And we think it's a couple things. One, like here in the United States, they've also gotten rid of most of their mitigation. So they've, removed masks. They don't require isolation if you're positive, and that likely contributes to cases. Also, we're probably starting to see the waning of both those who were infected with Omicron back in the winter. Now it's 3-4 months later. That natural immunity is probably waning. Those folks could get reinfected. Similar with folks who were boosted, that started, last fall. That immunity from that booster may be dropping a little bit, such that you're seeing more cases. The thing that's a little bit more tricky to explain is that they're also seeing an increase in hospitalizations, but not ICU beds. So then that raises the question of, well, is that, increase in hospitalizations with people that are there for COVID or people with COVID? They have other conditions that they're being admitted for. We just don't know yet. But there are parts of the country or parts of different countries that are seeing a bit of a surge in cases.
Did we stop the mitigation too soon?
I don't think so. I think the local data would suggest that with our current level of cases, it's okay to reduce those mitigation practices, but we have to be vigilant. We always have to watch, what's going on. Might we see something? Maybe, maybe not. Can we promise that there will never be a day where we don't need to wear masks for a week or two? No. But, until we see the data that says we should do that, I think we're probably okay.
And now there's a debate raging about a potential fourth vaccine, a fourth shot, COVID vaccine shot. Do you think that's a possibility for all of us or just for people who are maybe immunocompromised?
Yeah, I think for sure for the immunocompromised. There's even recommendations now that suggest that they get that fourth dose. For the rest of us, I think the day will come where it makes sense to get a booster, whether that's because we're seeing maybe more cases, maybe there's a variant that we have covered by a booster that none of us have yet. But I think the timing of that is still uncertain. The science behind it isn't certain how long that durability from our initial booster lasts. So someday I think we'll get it. Whether that's, soon or this fall, I think that needs to be determined yet. We just don't know.
And the doctor's going on vacation next week, so that's a good sign. You're not worried about it?
No, I feel pretty good about it.
Enjoy your spring break.
See you in a couple of weeks.
We'll see you in a couple of weeks. Thank you, Dr. Pothof.